You've been scheduled for a penile implant procedure. In general, this procedure is recommended for a man who desires the most rapid and reliable treatment option for erectile dysfunction. Most men have tried and failed some other forms of erectile dysfunction treatment or have side effects related to either medications or other treatment options. The day of the procedure begins in the preoperative area, where a nurse will check you in and start an IV. At that point, we'll start giving you some antibiotics through the IV. Once you get into the operating room, you'll be put to sleep under general anesthesia. Then we'll clean the genitalia and remove any hair from the area where the procedure will be performed. I would encourage you not to do any of your own hair removal at home because nicks and cuts in the skin might increase your chances of infection. Once this is done, we'll give you some nerve blocks that will reduce your pain after the procedure. Then we'll make a small incision about 3 centimeters on the front of the scrotal sac. Through this, we'll place the penile implant and then close everything back up using dissolvable stitches that will fall out on their own. We will usually also leave a drain, which is just a way to remove leftover fluid from the procedure. This is an external device that would be removed the day after the procedure in the office. Then you would wake up from the procedure and go to the recovery room. And then once you're fully awake and you've eaten and drank and urinated, you'll be discharged home. If you have a drain, you'll come back to the office the next day. In general, this is an outpatient procedure, meaning you go home the same day. However, many men come from out of town, from other states, or sometimes even other countries. It's often more convenient for these men to spend the night in the hospital. That way, if we leave a drain, it's removed the next day before they go home. Most men who live in the area are encouraged to go home after the procedure and, if necessary, return to the office the next day. Many of these men choose to get a hotel nearby the hospital so they don't have to drive all the way home, if it is a longer drive for them. In general, the clearances that you might need before the procedure include going to our preoperative anesthesia clinic. Sometimes getting a clearance from your primary care doctor might be needed, or even from a cardiologist if you have one. If there are any specific concerns about your medical history or that you might require further clearances, we'll discuss those at your preoperative visit. Because you will be undergoing general anesthesia, you'll need to arrange for a ride to and from the procedure. You'll likely be taking some narcotic pain medicine within the few days after the procedure. While taking these medications, you cannot drive. That means you'll likely need to arrange for a ride to and from the follow-up appointment the day after the procedure if a drain is left in place. In the days leading up to your procedure, there are a few instructions that are important to remember. Men who are on blood thinners should follow instructions provided to them about when to stop those blood thinners. I recommend using an antibiotic soap called Hibiclens, which can be bought at any pharmacy. Starting 2 days before the procedure, wash yourself once from head to toe using this soap. Repeat this again on the day prior to the procedure. Men who are smokers should stop 1 month prior to the procedure, and men who are diabetic should make sure that their blood sugar control is perfect for the week or 2 prior to the procedure. At your pre-anesthesia visit, we will discuss which medications you should continue and which you should stop in the days leading up to your procedure. The most important of these is blood thinners. All blood thinners must be stopped unless given other instructions several days prior to the procedure. More specific instructions will be given once again at the preoperative visit. At midnight the night before your procedure, you should stop eating or drinking anything, with the exception of a sip of water if you do have to take some medications the morning of your procedure. Once again, we'll discuss which medications to take and which to stop at your pre-operative visit. The day of the procedure, be sure to bring your photo ID, your insurance card, your cell phone and cell phone charger, and also some loose-fitting clothing like sweatpants, which can be worn after the procedure. You should not shave before the procedure. This can lead to nicks and cuts in the skin, which might serve as a source for infection. Any hair that needs to be removed will be removed by our team once you're asleep under anesthesia. The day of the procedure begins by checking in the surgery area. You'll then be taken to the preoperative area, where a nurse will check you in, check your medications, and start an IV. Antibiotics will be started in the preoperative area before you go back to surgery. Once you get into the operating room, you'll be placed under general anesthesia. Then we're going to clean the skin of the genitalia and remove any hair that might be necessary. We'll give you some numbing medicine, perform the procedure, wake you up from anesthesia, and then take you to the recovery room. Once you wake up, you'll be given some food and drink, and you'll have to urinate before you can be discharged home. It's normal to be nervous leading up to any type of procedure, especially one on such an intimate area. By watching these videos and doing research online, you can familiarize yourself with what you'll be going through and relieve some of the anxiety surrounding the procedure. There are a number of patient testimonials available online where you can hear people talk about their own stories. If you have any questions or concerns at any point, please feel free to reach out to me directly or to my office staff, and we'll be able to assist you promptly. If you have any questions at all leading up to the procedure, you can call my office at 216-444-1231.